We use lasers to treat pretty much anything. So we can treat sun damage, whether it's brown spots or red discoloration of the face, chest, or anywhere on the body. We can also treat for fine lines and wrinkles, facial resurfacing. So we can treat pretty much anything on the face or the body. One of the lasers, the Affirm Multiplex laser, we use for treating, it could be anywhere from melasma to basic sun damage to just fine lines and wrinkles. It's a microfractionated technology, meaning that it basically just hits every other piece of tissue. So that just basically cuts down on the amount of downtime that you have. So most patients just experience a sunburned appearance afterwards for a few days with maybe some minor swelling, and pretty much are back to work in a couple days. For instance, when I do it on a Monday, and by Thursday, no one would even know that I ever had it done. And we can also use this laser for treating scars as well. I've treated multiple scars, both on the face as well as on the body. The Cynergy laser is a laser that has actually two in one. So it has both a pulse dye laser as well as an ND YAG laser. So I know those are probably foreign terms to you, but basically they're two lasers that target a specific color. So whether it's a blue or purple or red discoloration, it targets blood vessels. So the laser, we can use it to treat patients for rosacea, or also just for little red cherry angiomas, the little red spots that they get on the face as well as all over the body. You can also use it to treat leg veins, and pretty much the laser just basically sees the color of the blood to target the vessel, which then will shut down or close the vessel with each treatment. On average, it usually takes anywhere from 2 to 4 treatments, and usually those are spaced about a month to a month and a half apart. Afterwards, you may have a little bit of redness, maybe some slight swelling. For the most part, patients do quite well and don't have much downtime at all. For lighter skin individuals that are looking to treat for facial rejuvenation of the face, the neck, and the chest, I like to use the Smartskin CO2 laser. This laser is a fractionated ablative laser, meaning that it will injure every other piece of tissue instead of all of the tissue. It's not like the old CO2 lasers that they used to do in the operating room, and they would ablate the entire outer layer of the skin. These patients, it took them a month to 2 months to heal from this, and they had to hide inside, and now many of those patients have that kind of white discoloration of their face, and because it's completely damaged their pigment cells. This laser now, with this technology, it's fractionated, so it's hitting every other piece of tissue, so you have much less downtime, but yet you're still getting the same result. So rather than a month, you're looking at maybe 5 to 7 days. This procedure no longer requires anesthesia and can be done fairly comfortably in an office setting. Once you go through your initial series, if you need a series of treatments, then can be maintained anywhere from, I'd say, a year, once a year, to once every year and a half, depending on the severity of what we're treating and the expected results of the patients.